Hi, I'm Dr. Neil King, founder of King Chiropractic. We're here today and we're going to teach you how to wipe out low back pain. Low back pain is one of the major reasons that people miss work every year, and also it's the main reason that people retire due to disability. That's an awful problem, but we're going to give you some tips today. Basically, I like to say how to wipe out low back pain with some exercises. One of the main ways to deal with low back pain is through consistent exercises that are done on a daily basis. I like to say that take about 10 to 13 minutes. We're going to start with the upper body stretch. We're going to do standing low back exercises. We're going to do some all four exercises for your core. We're going to do some one knee exercises for stabilization. Then we're going to work some more on your core, on your low back, and we're going to wrap it up by loosening your hips and your hamstrings. What kind of equipment are you going to use? What I want you to have is a simple mat. I want you to have comfortable clothing, and I want you to be in an open area where you're not going to get whacked by something. So let me give you some safety tips. If you're experiencing low back pain, if you're having any problem with any leg symptoms from low back pain, please don't do these exercises now. Wait until you get over what we call that acute phase, and then step back and evaluate what you need to do. Please don't do them if you're experiencing low back pain or you start to experience low back pain while you're doing the exercises. I'd like to take a moment to talk about myself. I discovered King Chiropractic back in 1984, which is 24 years ago now, and our offices in Gaithersburg, Potomac, and Urbana, Maryland. We've served top professional and amateur athletes for many years now. Our whole job is getting you back to where you want to be. I don't want you to just be alive. I want you to feel alive. So please stay tuned. We're going to go through these, and in the next clip, I'm going to be talking to you about stretching your upper body to help yourself. Hi, I'm Dr. Neil King, founder of King Chiropractic. Now, I promised you that we were going to wipe out that low back pain. Interestingly enough, we're actually going to start with your upper body today. I'm going to go over 3 simple exercises that are going to be designed to orient your upper body to the posterior or to the back. Because what happens is if you don't have proper upper body mechanics, you tend to kind of take this forward posture on, and that puts excessive pressure into your low back, particularly if your head is forward. So here's what I'm going to do. I'm going to give you 3 simple exercises that you need to do once to twice a day. Now look, I know we're working on your low back, but believe me, stick with me, we're going to get to that, but first we're going to have you standing up better, taking pressure off your back. The first exercise has been around for centuries, and here's how it starts. Very simply, both of your arms are straight overhead, and all you're going to do is kind of reach for the ceiling. 1, 2, 3. 1, 2, 3. Very simple, just an overhead stretch. 1, 2, 3. 1, 2, 3. I'm going to show you that from the back so you can see. I'm actually elevating my scapula or my shoulder blades, and here's how we do it. 1, 2, 3. 1, 2, 3. You're going to do that 5 times with each arm, once to twice a day. We never do anything in our life that stretches us out like that exercise. Next exercise, very simply. We stretch both of our arms straight out to the sides, palms up. You're going to pinch your shoulder blades together, and then I want you to just do reverse circles 15 times, just like that. You can tell they're not huge circles, they're very subtle circles. That's stretching out the front of our shoulder blades, what we call the anterior deltoids in the front, and also the pectoralis. And what it's doing is, in the pinching, which I'm going to illustrate now, we pinch our shoulder blades together to start the exercise, and then reverse circles. That works the rhomboids, those muscles between the shoulder blades. Again, 15 times, twice a day. To reiterate, nothing we do in our life really works to open up our shoulder blades like that exercise. Last exercise of this group for the upper body is very subtle. You stand like this. Your shoulders are oriented with your arms parallel to the floor. I want you to pinch those shoulder blades together and slide your arms back. You're just sliding your arms back. You hold it to 1, 2 count, relax, 1, 2 count, relax. It works those rhomboid muscles between the shoulder blades, and it also helps the rotator cuff, which starts in the back and comes around to the front. We're just like this. 1, 2, relax. 1, 2, relax. I want to show you that one more time. Just like this. Arms oriented. 1, 2, relax. 1, 2, relax. You're going to do 5 of those. Quick review. Overheads, circles, sliding the arms back. That wraps up that section of the upper body. We're going to actually work with you on some standing low back exercises that are really going to wipe out that low back pain. Hi, I'm Dr. Neil King, founder of King Chiropractic. We're back wiping out that low back pain. Now, we already talked about your upper body. Now I'm going to give you some exercises where you're actually standing and you're going to be working on your low back as well. Okay, here's how we do these. The first one is called a standing back arch. So many people, after they've experienced long-term back problems, their back becomes flat and it becomes very difficult for them to walk. What I've found in my 24 years of experience working with people like this is we need to tone up those abs and we need to give that back a small little arch that actually stimulates blood flow. Here's how you do this. You're like this. I want you to stand with your abdominals lightly toned, and then what you do is you just place your thumbs in your low back subtly, keep your head oriented straight, and then you're just going to put a small arch in your back. You just hold that for about 15 seconds. And then you relax. Now you don't want to hyperextend. You don't want to do this exercise where you're putting an arch in your back and your head's coming forward, because that's counterproductive. What we want to do is we want to have our head oriented, light abdominal tone, thumbs across our low back, and then a gentle arch. You stay there for 15 seconds, and you're going to do 5 of those once or twice a day. That's also a great thing to do if it's required for you to sit in meetings, fly on an airplane, things like that. That's why I put together this group of exercises, because these are very practical things you can use during the day to help your low back. This is the next exercise. This is called a back kick. Across our low back, we have 2 joints that you might have heard about. They're called the sacroiliac joints. They're right at the base of the spine where the spine meets or articulates with the pelvis. Those get stuck and immobile when people sit too long, particularly. And believe me, we all know we're a sitting society. So here's what we're going to do. Same position, light abdominal tone, standing, and then all you do is kick your leg back. And I want you to do that 15 times on one side, 15 times on the other side. How do people do this wrong? Frankly, they overkick. They do this. That is counterproductive. We want a very subtle motion in that sacroiliac joint, and you achieve that by a slight kick, 15 times on one side, 15 times on the other. Same thing. Traveling, we want to be sure that when you get out of an airplane seat, you do a couple of those while you're in the aisle, or when you go back to the restroom or something like that. Makes a huge difference. We're going to wrap it up with this set of standing exercises by stretching the calf, or what's known as the gastroc soleus. That's the calf region. When people have a bad back, their calves inevitably tighten, and that puts pressure on their back, particularly when they're bending forward. So one of the exercises that I've devised to address that is very simple. You orient your feet, you hold yourself upright, light abdominal tone, and then you lower your body. You hold it there for 15 seconds, and then you stand up. You do the same side 3 to 5 times. Alternate, same thing. 15 seconds, alternate, 15 seconds, 3 to 5 times on each side, once to twice a day. Quick review like we like to do: gentle back arching, gentle back kicks for those sacroiliac joints, and stretches to stretch out that gastroc soleus. When we come back in our next clip, we're going to be doing all 4 exercises down on the floor that are going to strengthen and stabilize that core. Hi, I'm Dr. Neil King, founder of King Chiropractic. We're back. We're still wiping out that low back pain, but now we've moved to the floor on all 4s. What this is going to do is this is going to stabilize your core through here and also give mobility and, interestingly enough, stabilization to your low back and also your upper back. I'm going to start gently with these, and there's a reason. Because I know in my years of experience that people tend to rush too quickly on exercises like this, and they end up hurting themselves or they get frustrated by the increased stiffness. So stick with me. We're going to start slowly. Here's what you're going to do first. You'll be in this position, abdominals in, and all you're going to do is just raise one arm and then the other arm. It's as simple as that. Now, people are amazed by this exercise, but what it does is it actually teaches our upper shoulder girdle, the rotator cuff, the glenohumeral joints, all of those things to stabilize and give mobility while our low back is firing. So what we're doing is we're just doing 15 times alternating each arm and each leg. That's our first exercise. We're going to do 3. The next exercise is simply like this. Head straight ahead. Again, my head isn't up. It isn't down. And what I'm going to do is I'm going to lift my leg. A lot of you have probably seen this exercise in exercise videos. But I want to stress something. This is not straightening your leg and bending your head down. This is keeping your head neutral and straightening one leg at a time. 15 times with each leg. That works the sacroiliac joints, which we mentioned earlier, and it also strengthens the gluteal muscles down in the low back. Now, we're going to put both of those together. And I want to stress the way to do this is to do the shoulders, the low back, and then do them together. And this is how you do it. 15 on each side. That's working the shoulder girdle, the sacroiliac joint, the gluteal muscles, and firing the abdominals to give the area the support that we need to wipe out that low back pain. We did the arms, the legs, and we did them together. When we come back, we're going to be working on more core strengthening exercises, and I can't wait for you to see those. Hi, I'm Dr. Neil King, founder of King Chiropractic, and we're back wiping out that low back pain. Already we've reviewed the upper body, we've done some low back stretches, and also we've done some things on all 4s that you're probably familiar with. I'm thinking that most of you haven't seen this exercise for your low back, but believe me, it makes a huge difference in the mobility in your low back and that all-important hip. We want to make sure those hips stay mobile because with good hip mobility, your low back is going to feel a lot better. So here's what we're doing. I've got one foot forward and I'm kneeling on my knee. Then what I do is I just relax my left arm. I'm going to put my right arm overhead and subtly stretch it to the opposite side. 1, 2, 3, 4, 5, and then I return to the start position. That's very important because we want to teach ourselves to move. This is a great kinesthetic exercise. The arm goes overhead. 1, 2, 3, 4, 5, and we return to the start position. You do that 5 times on one side to a 5 count, and now you change sides. The right arm is relaxed, the left arm goes overhead. 1, 2, 3, 4, 5. Back to start position. 1, 2, 3, 4, 5. Very subtle. 5 count, 5 times each side to give that hip mobility. I'm going to move on to a hip slide exercise. Same position, foot forward, hands on your hips, and I want you to lean your hip away. You stay there for 10 seconds. Back to the middle. Lean your hip away. 10 seconds. Back to the middle. Alternate. 5 times on each side. Lean your hip away and back to the middle. That's going to give that hip mobility, and it's going to teach your lower body to stabilize itself when you're lifting and twisting and moving things. And we're going to continue wiping out that low back pain with exercise on our back next time. Hi, I'm Dr. Neil King, founder of King Chiropractic. We're back. We're wiping out that low back pain, and now we're in a position that most of you are probably familiar with for back exercises. But I want to reiterate, we did not start here. We started by working on your upper body to teach you how to stabilize your low back. Now we're going to focus on that famous core conditioning and also mobility throughout the hips and pelvis. And here's how we're going to do it. The first exercise a lot of you are probably familiar with. It's called a pelvic tilt. But in my 24 years, I can't tell you how many people have said, oh yeah, I know how to do that, but they don't quite have the mechanics down properly. Here's what I want you to do. I want you to think about your hips as a clock. And what we're basically going to do is we're going to just kind of dial the clock. And here's how you do it. You're in this posture, and you're just going to take a relaxed lower body, pelvis, abdomen, and everything. Tone your pelvis and slightly flatten your back. So the way that I talk about it is it's kind of taking a clock that's relaxed and turning the clock hands. You're going to hold that for 15 seconds, and then you're going to relax it. You just want to keep your head and your upper body relaxed. You want to feel everything in the transverse abdominis, the muscles down in your lowest abdominal region. You've got the transverse and then the rectus. We're going to work on the transverse. Again, and you're going to hold it again, and you're going to hold it there till 15 seconds, and then relax. And you're going to do 5 of those. Now we're going to follow that with a couple of advanced exercises, and that's these. They're called bridging. You're going to start with the pelvic tilt that we just started. Dial that clock, hold it momentarily, and then gently lift it. You'll notice I am not lifting and hyperextending my back in any fashion. I'm not trying to get to any particular position. What I'm really doing is I'm just flattening the low back, and then I'm elevating for about 3 inches off of the floor. Very subtle. I'm going to hold that for 15 seconds, and then I'm going to relax it down and start over. I'm going to do 5 of those. One more quick exercise. Same thing, same basis. I'm going to change the clock, flattening the back. I'm lifting up the pelvis, and now I'm going to take very tiny steps. I call this bridging with tiny steps or bridging with marching. This is the ultimate core stabilization exercise, where you're just like this, each side, do each side 10 times, and that wraps up the segment on your low back. When you come back, we're going to do some stretches to loosen up those hips and finish up wiping out low back pain. Thank you. Hi, we're back. I'm Dr. Neil King, founder of King Chiropractic. We're wiping out low back pain, and as a matter of fact, we're going to be wiping out this video series in just a minute because this is the last clip that's going to change your life living without low back pain. And here's how you're going to do it. The first exercise is very subtle. It's just like we started with the last clip. I'm going to flatten the pelvis out by dialing the clock. I'm going to lift this, and then what I'm going to do is I'm going to straighten one leg. I'm going to hold it for about 3 to 5 seconds. I'm going to relax it, and I'm going to straighten the other leg. That's it. I'm going to do that 5 times on each side. Now you'll notice you're alternating side to side. This stretches the hamstrings, the muscles that you're all familiar with across the low back region, the pelvis region, and also into the upper part of the lower leg. So that stretches that safely for people that have been experiencing low back pain. A quick review, you're going to flatten, elevate, straighten that leg, 3 to 5 seconds, straighten the leg, 3 to 5 seconds. 2 more quick exercises that are going to be designed for you to stretch your back after doing all these stabilization exercises. People forget how important it is to keep their back stretched. It seems like most people do a stretching program or they do a strengthening program. This incorporates both. And here's how you're going to do it. You're going to gently flatten that low back, and you're going to let your knees fall to the side, and you want to leave it there for about 15 to 20 seconds. And then you're going to come back to neutral. And then you're going to go 15 to 20 seconds the opposite way. And you're going to come back to neutral. People do this wrong by rushing. They throw their knees to one side, they throw their knees to the other side. Please don't do that. Do 15 to 20 seconds one way, nice and slow and subtle. Come back to neutral, and then go the other way. 15 to 20 seconds, 5 times each way. The advanced version of that is this. I call this a figure 4 stretch. You're actually going to take your ankle, orient it onto the opposite knee in this fashion, and then all you're going to do is just let your knees go over just like you did last time. You leave it there for 15 to 20 seconds, come back, and then go the other way, 15 to 20 seconds, and come back. I'll tell you, this is a terrific hip and hamstring and low back exercise that is frankly not fully appreciated. So 15 to 20 seconds each way, 5 times each way. That's going to wrap up wiping out low back pain. There's lots of reasons that people experience low back pain, but I can tell you one thing. By doing these exercises consistently, you're going to find that you're able to do things more productively, you're going to feel better, you're going to look better, and you're going to be out there enjoying life instead of nursing a low back problem. Thanks for joining me. Talk to you soon.